Hello, welcome back to my channel. Oh golly, it's kind of warm down here. I just thought I'd stop in. I know it's been a little bit since I've checked in to kind of give an update on what's going on or what I'm doing. So a little bit of an update and then on to what I'll be doing. So I'm finding myself a little stressed. My husband, back in November, this is August, my husband back in November had a little bit of an accident, and here we are in August. Like I said, we found out back in July, after many months of him hurting and going to the doctor for workers' comp stuff, that he has to have shoulder surgery. They didn't find it. This should have been done like months ago, but the doctor that he went and saw in the beginning kept telling him that it was just a muscle issue kind of a thing, and blowing him off, giving him different medications to try. No narcotics or nothing like that, but ibuprofen, Tylenol, giving him steroid shots and stuff. And of course it didn't help. And so he had an MRI done, and now he's got to have shoulder surgery. So they're telling us 4 to 6 months that he won't be working. Right now, we're trying not to answer too many of his questions, because it's not necessarily that I'm afraid he'll chicken out, but I'm afraid he'll chicken out. And essentially the doctor told him, here's your choices: 1, hurt the rest of your life, or 2, have the surgery and get some relief from that. So that's what he decided to do. He has a couple tears up in the rotator cuff area and in his elbow. So here in about a week and a half, he'll be having some surgery. But right now I'm down at my daughter's, and I've been on and off down here the past couple months. I was down here for a few weeks, had to go back home. My dad passed away. Came back down for a couple weeks, went back, took my grandson back home to West Virginia, and then that, now school's getting ready to start, so we're back down here. So school will be starting this next week. So, life goes on kind of a thing. But the surgery part, that means my husband will be not working during this time. Of course, that surgery and all that fun stuff that he'll be doing, rehab. So this will be something new for us that we've never had to deal with, is working with workers' comp, figuring all the ins and outs, and learning about that. Ooh, I hear a plane. So, learning the ins and outs of dealing with them. Some have a little bit of anxiety, and it's not necessarily scared kind of a thing. I feel like I'm kind of prepared for this, and learning how to deal with things like that. We've never had to deal with anything like this before. The good news is it's just me and my husband, that we need to take care of ourselves kind of a thing. So it gives me a little bit of an insight on what we'll be dealing with in 10 to 12 years when my husband goes to retire. So I'll be a little bit better prepared then. At least that's what my hopes are. I'm going to, learning that stuff. So I'm going to share some, things with you on this journey that we're about to go on. And then, so it brings into kind of practice. I get to practice what I'm doing let me see how to say this. Okay, so there's some cookbooks that I want to try out, and it's back from the 40s and 50s, and I'm not sure exactly what the dates were. I don't remember now because they're at home and I'm not at home. But I'm going to be working through those and coming up with some really cool things. Kind of following what some of the recipes were on things that I have at my house. I want to try to spend the least amount of possible for utilities, for food. Some things are changing. You know, we'll be working on some budgets. And you know, hopefully you can learn along with me what to do or not to do. That way things won't be a surprise if you have to ever go through something like this or anything similar. So, you know, life's definitely a challenge. It's definitely a ride. But, you know, once I get back to the house, and it'll be a couple days before I get back on. I've got to have, before our insurance runs out, I've got to have some dental work done. And normally I don't have issues with root canals, but this time it's going to be my front teeth on top. Some fillings from the past have fallen out for whatever reason, so they've got to be repaired. And one, they didn't finish the root canal, I guess. So that's something else that I guess we need to learn, you know, when we're in the dentist, to ask for proof that they did finish the work that they had started, like root canals. So, you know, learning from those mistakes. But anyway, I just thought I'd check in real quick. I know it had been a while. But I'm hoping you have a great day. And we're about to learn something here in the next few weeks. And let life be a ball. Talk to you later.